Lancaster General Hospital in Pennsylvania. He currently works clinically at the Inclusion Health Clinic for Frederick Hospital at the Sargent Health Center over in Wauwatosa. And his clinical focus is kind of focusing on the treatment of the LGBTQ population in our area and providing primary care to those patients. So with that, I think he's going to have a great presentation for you guys, and I think an opportunity for question and answers at the end. So we invite you to kind of participate and ask any of the questions that you've been hoping to ask. And with that, I'll turn it over to Dr. Robertson for the presentation.
Thank you very much. That was all off the top of his head. I don't think I could remember those details about myself.
I don't remember anything helpful.
So, like Matt said, I work with the LGBTQ population, so a lot of those letters get jumbled together, and sometimes we have to kind of pick them apart, so that's one of our goals for tonight. When I started my medical training, the first patient that I saw was a transgender man, and at that point I kind of had an inkling of what I wanted to do, and that just kind of solidified things for me. And my trajectory since then has been the same. It's something that I really enjoy. It's a community that I'm passionate about. And I think that there's a lot to learn, and people's exposure to this community is sometimes pretty minimal. So we might be starting at a very base level, which is fine. So part of this presentation is mostly just going to be building a vocabulary so that we can all speak the same language and kind of know what we're talking about when we dive into some more particular pieces of this. So this is my clinic. It is on the Frederick main campus in Tosa. We're out of the Sargent Health Center. I also I volunteer at Brady Street STD clinic. So that's on Brady Street in Milwaukee, free STD clinic. So I covered a little bit of this. In my intro, it says charting. I have hidden all of the slides specific to charting. This is a presentation I give to the emergency medicine residency program. So there's a good bit of overlap, but I'm not going to bore you with the charting needs. So just a couple of cases to kind of illustrate some of the things that can be particular to the trans community when it comes to particularly health conditions. So a patient is presented to the emergency department with a chief complaint of heavy vaginal bleeding. With a brief charting, you wouldn't be charting, you identify that this patient is a trans man assigned female at birth. He's on gender-affirming testosterone. He has had gender-affirming top surgery, but no bottom surgeries. So these are the sort of cases that can come up in an emergency setting. And it is important to know, because if you see a transgender man, most trans men who are on testosterone, you wouldn't clock him on the street as anything other than a guy who might be a little bit shorter. So if a man his chief complaint is heavy vaginal bleeding, you have to have the ability to, or the understanding, the background to be able to know how to help this person. This is a case that I saw in the hospital. I do some inpatient work as well. So Shay is a 34-year-old admitted for high fevers, has bilateral buttock and thigh swelling and pain. Was started on IV antibiotics in the emergency department with presumed soft tissue infection. There was little improvement, so ID was brought on board to tweak with the antibiotics. And the question was, for them, what antibiotics should this patient be switched to? On history, this is a patient who actually had filler injected into both buttocks and upper thighs about 9 years ago in a non-medical setting, so kind of like a backyard, back alley situation for filler. And then they got a CT that showed hundreds of nodules throughout the buttocks and thighs, which are basically this filler that has disseminated through their lower extremity. So dermatology was brought on board, they biopsied, and because we had details about this person's past medical history, which was influenced by her gender identity, she was able to be treated appropriately and was actually discharged pretty soon after. So this is sort of a way to conceptualize some of the distinct components of the LGBT community. This is the genderbread person. You may have seen the gender unicorn as well. This is to just help separate out some of these things and maybe give us a little bit more clarity on what we're actually talking about. So the first component, and perhaps the easiest to understand, would be biological sex. We more often will say sex assigned at birth because this is what, when I'm delivering a baby, occasionally we will shout out it's a boy, it's a girl. You may have done this on the side of a road or in the back of a car. So this is more or less what we can assess from the outside, external genitalia. That is, we don't know usually anything about chromosomes, although that could contribute to someone's biological sex as well if you do have that information. That is different from gender identity. Gender identity is an individual's sense of manness, womanness, masculinity, femininity. This is something that is distinct from sex assigned at birth, because this is something that develops as children age. So there is a normal age where kids start to become aware of not only themselves, but sort of the cultural context that they're growing up in. And this is usually starting to happen around 4 years old and then continues through adolescence. During that time, it's normal for kids to be exploring their gender. So this can be things like, boys putting on girls' clothes, interest in makeup, an interest in something that would usually be assigned to the opposite gender. All of that can be normal behavior, and that doesn't mean that somebody is trans. Even if a kid has a pretty strong sense that their gender identity may not align with their sex assigned at birth, that does not mean that they are trans until they reach adolescence. Before adolescence, we really don't know if that sort of sense of themselves is going to persist or not. Things really solidify once puberty starts and once these kids start to grow into whatever their longer term gender identity will be. So just to give you a sense of numbers, for kids who are pre-adolescents, who have a gender identity that is different from their sex assigned at birth, about half of them will, during adolescence, those two things will end up matching up. And then about the other half would continue to have that sense that their gender identity is not aligned with their sex assigned at birth. Once kids hit puberty and that gender identity sort of solidifies for them, it is unlikely to change. This is something that persists throughout a lifetime, whether they recognize it or reckon with it at all. So this is something that seems to be very firmly innate in every individual. And although the majority of people do have correspondence between their sex assigned at birth and their gender identity, there is a significant slice of the population for whom that is not the case. And it can be very distressing, which is something that we're going to talk about a little bit more. Both of those concepts are different from how we express our sense of our gender to the outside world. So this is everything from how we dress, how we talk, how we interact with people, sort of the cultural norms that govern what is considered masculine and feminine. And there's obviously between cultures different ways that is done. But there are pretty significant clues that people can give, especially in our culture, makeup, the way that we dress, that can sort of clue you into somebody's gender expression regardless of how they may look. So, gender identity, sex assigned at birth, totally distinct from attraction, either sexual or romantic. Knowing somebody's sex assigned at birth or their gender identity does not tell you who they might be attracted to. So, sexual attraction is basically who an individual is sexually attracted to, and that can be any combination of all of these things. So for many people it would be, women or men. It could be people who present more feminine, people who present more masculine, could be both, could be everybody. And then that is sometimes, usually these two correspond, but not always, but sometimes somebody can be sexually attracted to one gender, but only romantically attracted to another. So there are different combinations that this can come in, although they usually will correspond in some ways. So that is sort of the overall first take here. What questions do we have at this juncture? I've explained everything.
You said half the kids growing up aren't sure if they're male or female?
So what I was specifically talking about is kids who particularly present to places like pediatric gender clinics with a sense that they might be transgender. For those kids, once they hit adolescence, about 50% of them will have a persistently trans gender identity, and the other half will end up being cisgender.
So it's not all the kids in the world, that's just the ones that present at clinics.
Right.
Okay.
For many kids, it's just think back to your childhood. For many of us, it was probably a pretty cut and dry thing that we didn't even think about. It just seemed like the default, which is the case for the majority of people. So when we are trying to empathize with, understand these transgender, non-binary folks, it can be a little difficult to try and put yourself in those shoes because it felt just so normal the way that you developed. And you have to imagine, if it felt so normal for you, imagine if it hadn't been that way. If you had been assigned your gender at birth, and then your gender identity developed the other way, just try for a moment to put yourself in that person's shoes and imagine how distressing that would feel if your body started developing in the opposite way that you felt matched up with what you felt on the inside. It can be really, really dysphoric is the medical term we use, distressing. That's a great question, though.
So continuing on that question, what percentage of kids end up in the clinic? Is it single digit numbers, half digit numbers?
Do you mean of all kids?
Yeah.
So actually,
You got 1,000 kids born.
I'm going to jump ahead a little bit because in terms of demographics, this is not specific to children. This is specific to the general population, so we can extrapolate to children. This is looking at just what slice of the population are we actually talking about? How many people does this actually apply to? Is this a tiny portion of the population, or is this somebody that you're actually pretty likely to encounter? And the answer ends up being the latter. So for people who identify as anything lesbian, gay, bisexual, anything other than straight, we're talking like somewhere between 3 to 12% of the population, so like 1 in 10-ish of people. So that's a pretty big slice. For anybody who's transgender or whose gender identity doesn't match their sex assigned at birth, we're talking somewhere around 1%. So that lower end is, if you look at older population studies, it tends to be on that lower end. And as we get closer to the present, that number has been rising. So the current studies are actually a little bit above 1% at this point. So that is still 1 in 100 people whose sex assigned at birth is not going to match up with their gender identity. And especially, gosh, what generation are we on? Gen Z? The youngest kids at this point? I think, so this was in 2021, and this was looking at a high school population. So this caught my eye because it was in the pediatric journal, and it matches up with what I'm seeing in the youths these days. So they surveyed about 3,000 high school students, and they were basically just looking at sex assigned at birth versus their gender identity. And about 9.2, so almost 10% of those kids had a discongruence between that. Their sex assigned at birth didn't match up with gender identity. So compared to that 1% that we saw in the general population, I mean, an urban high school is probably a pretty comfortable and accepting place. So we're probably seeing higher numbers there, but it kind of gives you a sense that this is something that is going to be more common as society becomes more open and as this is more accepted. Does that answer your question?
Mm-hmm.
Yeah.
Does becoming more accepted mean popular?
So you might be referring to like social contagion, which is the concept that as kids maybe see friends who are coming out as transgender, they think that it's like a trendy or cool thing that's happening. It's not something that we see actually happening like when we do studies or in my experience when I'm seeing kids in clinic. This is a very innate quality, and this is why we do, as like with everybody, but especially with kids, we're often working with therapists and counselors to really pick apart a kid's experience and kind of try and get to the core of it and say, okay, this is actually something that, there's a clear discordance here and we should do something about it. So, separate from the, or moving on from the genderbread person, which is sort of those base concepts, some of the terms that you might hear that have already been thrown around, I apologize for diving in. When it comes to gender identity, the the majority of people will fall into this cisgender category. So I've been saying this a lot, but that's somebody whose gender identity is the same as their sex assigned at birth. So someone was, you know, the doctor called out it's a boy, they end up identifying as masculine or a man, cisgender person. A transgender person is a person whose gender identity does not match that sex assigned at birth. And that could be, you know, they identify on the opposite end of the spectrum, they identify somewhere in the middle, just something different. So transgender is more of a umbrella term, and then we'll talk about some of the more specific phrases that can distinguish in that population itself. So that's things like if you see a transgender woman, a trans woman, you're talking about somebody who is assigned male at birth, but whose gender identity is as a woman. So that would be a transgender woman, trans woman, or in the medical terminology, you will often see something like male to female, but people in the community don't really use that. The same would apply to transgender man or a trans man, or somebody who is female to male transitioning. There are broader categories along that spectrum. So somebody can be transmasculine. They may identify all the way as like a man, but they're more on the masculine side than the feminine side, and they were born on the opposite end of that spectrum. So they're trying to move in whatever direction that is. And then there are people who, the experience that I hear most commonly is somebody who's gender fluid. It's something that, you know, day to day, it's kind of mercurial. It can change. They don't have some sort of set gender identity for themselves. And some people summarize that as more gender queer, which might just be, they don't have a clear sense of what that gender identity is. Non-binary is, they don't align with either end of the spectrum. They're not trying to be more masculine or more feminine. It's just somewhere in the middle, and they don't really like to put a masculine or feminine label on it. Are these phrases or terms that you have come across, or is this mostly new to most of you? Could be new, probably new. Questions about some of those phrases, some of these terms?
I guess just for our purposes, can we just ask them what gender they were with, or?
That can be valuable
How we
information.
relate to hospitals. You know, we just ask the patient what gender they were with, or.
Yeah, a little bit later on I get into like
Oh, okay.
how we interact with trans people, so if you don't mind, I'll delay
Oh,
to
yeah,
that point.
no problem.
What's on our state report? What options are there? Is it male, female, or other? Other?
Any other questions on this before we move on?
What age does this stuff start manifesting itself?
So this will be that sort of solidification of someone's gender identity would be at adolescence, which is going to be somewhere between 11 to 13, maybe a little bit older for people assigned female at birth.
Right, and so at that age, do you find, like, what percentage of kids are actually able to articulate this sensation? Or is it brought to bear from parental units who are observing stress of some sort?
It's a great question, and oftentimes this is something that these kids are, you know, they know that something is different about them from the majority of their peers. It causes a great deal of distress, and it's often something that they're not able to talk about for a while. So many of the kids who are, you may have heard the term coming out, that's sort of like disclosing what your gender identity is to a subset of people or the world. They're coming out, usually, I mean, there are kids who come out early on, like they have that sense of that discordance. They come out at that time, and that's fine. For a lot of kids, it's much more of a journey, a struggle that they'll go through, and they, you know, we hope that they're able to sort of grapple with that and find help within months to years, but it's going to vary a lot from kid to kid. I see, you know, 20-something-year-olds who, they tell me, you know, they come into the office and they're like, as soon as puberty started, I knew that what was happening to my body was not what I wanted, but it has taken until this time for me to come out to my family, to come out at work, to be ready to actually engage with whatever medical care they were interested in.
And what percentage do you think get it wrong? Right, I mean, they're kind of running experiments in their head, but, so they might think something early on, but find out later it's not.
This is,
what they thought it was.
it's a great question because we want to make sure that if we're going to offer something like hormones or surgeries, we want to make sure that these kids or young adults, wherever they end up being in life, that it's not something that they're going to look back on and say, "Oh, and I was wrong. I didn't want that." But what I point anybody who is cisgender in the room, which is probably most of us, what I point us to is that sense of your own internal, I'm a man, I'm a woman. Was that ever a question to you? Maybe it was. But for the majority of us, that is a very solid sense in ourselves. And it may not be something that you've thought about, but like I was saying earlier, just imagine if you had that solid sense, but your body was something that was assigned the opposite at birth. That is what we're talking about. That is what transgender is. So these kids come in, and it is, just as real to them as it is to any of us who are lucky enough to be cisgender.
Let's back up just a step here from what you were saying. Are these kids, do they ask, is it because of my parents?
It's more often the parents who ask that.
Are we finding out that the parents that are matched up when they have a kid or a child, that you're seeing that as they get older, is it because of my parents?
I think the more common scenario that
I don't know if I'm asking the right question.
Well, I don't know if I totally understand, but let me see if I can get to what you're getting at.
Are you saying the parents blame themselves?
No, I'm just saying, when two people match up, get married, and have a child, do these kids at adolescence say, is it because of my parents, of their genes, or their,
It's like having brown hair or blue eyes.
right?
It's
I
not
mean,
something
are
I
you
hear
seeing that or
from-
not?
Not so much. Not from the kids. I do hear from parents a good bit, like, was it something I did? Was this something I did? And the answer that I give them is no, this is something that really does seem to be truly innate to each individual. So if that person's sense of gender developed in a way that was different than we thought it would, that is not because of the outside influences. That is mostly driven from what was going to be regardless. And there's always some component of nature versus nurture, but this truly does seem to be one of those things that is predominantly a person's innate nature. But I definitely do get the parents asking, was it something that I did? Pretty frequently. This is great. Any other questions along those veins?
Just
or-
one, what does cis mean in cisgender?
That's a great question. So this is actually kind of sciencey terms. So it's either Greek or Latin. Cis means on the same side, and trans means on the opposite side. So if we're thinking about a spectrum, a cis person, their sex assigned at birth matches their gender identity. They're on the same side. A trans person, sex assigned at birth, does not match the gender identity. This is actually, it comes from chemistry. It's something that we used in chemistry and then got applied to this community.
What about the teenagers that think they're an animal? Or a furry? I mean, that's out there now. I mean, so.
Yeah, and there is some conflation of some of the kink communities, like furries, with gender identity, and those are really, it's kind of like the, sexuality versus gender identity. Those are often separate things.
So you're saying it's easy to determine what assigns sex at birth, it's chromosomes, but for what decides gender identity is a lot of different factors?
Definitely. I think that's a great way to
And
summarize it.
it's both gene, or it's internal factors and exposures?
More, it seems, the internal factors. And I'd say that just because there have not been any external influences that when we do studies have been identified as, you know, someone who is exposed to X is more likely to develop a gender identity that differs from their sex assigned at birth. So definitely more of that internal nature side of things.
But it's not in any type of chromosomes or anything.
No, so often, you know, in the vast majority of cases, we know nothing about the particulars of a person's chromosomes. We can presume based on what we see externally, but very few times would you actually do the study to actually see that information. There are cases like the intersex community, which has some overlap with the trans community. That's somebody who may have a chromosomal abnormality where they have, usually it's an X and a Y chromosome, or an X and an X chromosome. Those are usually the two situations that are the norm. There are situations where people can have different amounts of chromosomes, like XXY. And those people can develop certain external genitalia or not have complete internal genitalia. So there's definitely gray areas that are beyond what I'm planning on talking about tonight. So the chromosomes do play a role, definitely, but it's not necessarily information that we have oftentimes. In almost all cases, we're judging from what we can see on the outside. All right, I'm gonna press forward. So particularly when we are working with the trans and non-binary community, I have some LGP terms up here as well. We want to be using terms that aren't going to be stigmatizing for them or that they're going to, you know, have a reaction to. So an example of this would be homosexual. These days, you more or less just want to say gay, lesbian, bisexual, something along those lines. Things like sexual preference or lifestyle choice, you know, we use the phrase sexual orientation at this time. The terms transvestite and transvestite or transsexual have been used in the past, even in the medical literature. It has become very fallen out of favor. The implication when you use the term transvestite is somebody who is just pretending to be the opposite gender. Whereas for these people, it is a very real and lived experience. So to call a transgender person a transvestite is deeply, deeply offensive. And then transgendered is just making the point that we don't put the ED on the end. So like, I don't say cisgendered or transgendered, it's just transgender or cisgender. And then the biological sex, like I mentioned earlier, or genetic sex, which would be referring to chromosomes. We usually say birth sex or sex assigned at birth.
What do we call heterosexual people?
Heterosexual is fine, straight, yeah. What do you like to be called? Any of the straights in the room? Any preferred phrases?
George.
George? I love it.
Quick question. Is that a gender queer, isn't queer an offensive term?
It has been, so for some people it can still be offensive. It has been more or less reclaimed by the community. Oftentimes, instead of listing out LGBTQ+, I will just summarize as queer because it just kind of encompasses any of the population who's not cis, gender, or straight. But great question. Another phrase that you probably won't come across because it's mostly like academic literature would be gender expansive or gender diverse. That is just trying to encompass everybody who's not cisgender, which the term transgender more or less does. So for people who are trans, this is referring mostly to adults who have had the opportunity to engage with medical and surgical options. Some of those people will choose to have medical or surgical ways to alter their bodies to affirm their gender. And when we say affirm, these, we're giving hormones or doing surgeries to align their external appearance with their internal sense of their gender identity. Some choose that they don't need any of those options. Some will choose some combination of medical and surgical options. And there's no right answer, it's all whatever that individual feels will be best for them. Some may change their outward appearance, so that could be like the gender expression that we were talking about earlier. So people will present more feminine, present more masculine, whatever makes them feel best in terms of their gender identity. Some people will choose to make no changes to their appearance, so this could be like a non-binary or genderqueer person. They may feel on the inside that they don't necessarily align as a man or a woman, but they don't feel the need to make a change to their outward appearance. It's just not how they feel on the inside. And then this has many will end up changing their name. So it's pretty common in the trans community. They'll have their legal or what they were named at birth, and that is usually what we call their dead name. So dead naming somebody is also a pretty big no-no if you know what their preferred name is. So that's often not what would be on official documents, on their driver's license, anything like that.
That's what I was gonna ask, and when does legally, medically, their sex or name, can they change that?
There's a whole, so it varies from state to state. So I will speak just of Wisconsin. The easiest way to go about this, and this is something that many of our trans folks will end up doing, the easiest place to start is just the driver's license. So you just need a letter from your doctor, the person who is helping you with whatever medical and surgical transition you're going through, to write that you have had appropriate treatment for it to warrant a change in that in the driver's license. The next step is usually birth certificate. You can change your birth certificate to the opposite gender. It is only male or female in that realm. And then there are like more particular things like changing your gender or legal sex on insurance, for Social Security. There's a whole realm of things where you can change, and many do dive into that. When somebody meets that criteria is between them and the doctor. So this is often something that for what I encounter in my patients most frequently, this is something that once they've been on hormones for some amount of time, sometimes they will have had gender affirming surgeries. That's when they will choose to go ahead with that. If that's the case, then I happily write the letter for them. Other questions? Great. Talked about the demographics. So about 1/10 of the population is going to be something other than straight or George. And the other half, and about 1 in 100 people is going to be somewhere transgender, somewhere under that umbrella term. So for the trans community, there are a lot of barriers, not only to healthcare, but throughout their daily lives. I focus mostly on the healthcare aspects, but this is a community that is more likely to be sexually assaulted, be involved in domestic abuse, be assaulted for any reason, and to be murdered. So there is a lot of disparities in the societal sense, not just in healthcare in particular, although they are significant in this venue. So trans folks are more likely to be uninsured. They're often going to fear stigma and judgment because those are things that they have experienced when they engage with not only the healthcare system, but in general, different institutions in society. And then when they come to see me or any healthcare provider, they're often thinking about, am I gonna have to teach this person about what I am and what I need from them? And then they may be worried, you may be the first person they ever come out to, so they may be worried that this is something that might get out somehow.
So, when you say, are they gonna have to teach you about themselves? The answer is yes.
Sometimes.
Because every single one of them's different, right? And you can't you trying to avoid making assumptions about somebody's particular situation, so you really need them to tell you what it is that's going on. Right?
Absolutely. And when I say this perceived lack of understanding or trust, questions like, what are your pronouns? What name do you go by? What was your sex assigned at birth? What is your gender identity? Those aren't offensive, you're right. Those are baseline information questions and things that I encourage you to ask people. I'm speaking more of like, in my context, when somebody is coming to a primary care or somebody and they are looking specifically for something related to their gender identity, hormones, surgeries, if they have to do the teaching and education to that provider, it is often a big reason why they don't seek care, because they fear that.
That's why there's a free clinic on Brady Street, right?
That's specifically for STS, but we do serve trans and
I'm just,
non-binary
but
folks.
that's the whole thing, is that people with STDs would rather go to a clinic on Brady Street than run to their regular primary.
Oh yeah,
There you go.
very common. My patients are unfortunate because I volunteer there as well, so they can't escape me. So a lot of the more recent information that we have comes from this very large national survey that was done in 2015, the US Transgender Survey. Had a lot of respondents. It was one of the, 2015 was actually one of the first times that we collected like large scale information about this community. And surprise, it's very depressing. So about 14% of trans folks are uninsured, which is greater than the general population. For those who are out to their healthcare providers, HCPs, about 40%, all of their healthcare providers knew that they were trans. For about 30%, some of them knew, and then about a third, none of their healthcare providers knew they were trans. Negative experience, this is again specifically in healthcare, but it is everything awful you can imagine happening to you in a doctor's office, including physical assault. About 2% of them have experienced physically rough or abusive behavior in their healthcare provider's office. So really not a great track record when it comes specifically to healthcare for this community.
For the community in general, not this community in this area.
Right, so this is the national
The
survey,
healthcare community.
and everybody who replied to this identified as trans or non-binary.
But in 2015, that's 8 years ago, there's been a lot of cultural adaptation in that time to make these numbers pretty much vastly outdated.
I sure hope so. I believe there's another nationals, I think they're repeating the same survey. But I think it was set for 2020, I think the pandemic interfered with that, so I actually have kind of lost track of that. I'm not sure when that will be.
It's time for a new one.
It's time for a new one, I agree. So sort of the culmination of all of those negative health experiences is that about a fourth of these people will avoid seeking health care due to fear of being mistreated. So that is sort of the outcome that we see based on their past experiences. So, questions about sort of the demographics, any particulars about the community before we dive into what we can do from our side? Y'all have had great questions. Okay. Some of this is phrased more as like if you're encountering somebody in the office or in the ED, because that's what this presentation was initially geared towards. But a lot of it is just generalizable in terms of like how we introduce ourselves and what sort of questions we ask patients. So when you are encountering somebody who is trans or non-binary, one of the best approaches is just to come with an attitude of cultural humility. You don't have to know everything about them or the community, and they don't expect you to. It's just something that, if you have an understanding of that and you're approaching them and you're open and willing to learn, then that's gonna go a long way for anybody in any context. So that's a good starting place. So try and approach without preconceptions and meet people where they're at. So that may be somebody who has gone through a full transition. They look like a man, they look like a woman, and they are trans. Or it could be somebody who's early on in that process, or maybe not even out at that point. And then it's important in any context, and in particularly with our trans patients, to not project our life experiences onto others. So just trying to treat everybody with respect and not making those presumptions about them, coming with our preconceptions. One of the things that I struggle with, because I'm from Georgia, is from early in my childhood, it was just ingrained into me to sir and ma'am everybody. And when you're working with a gender diverse population, it's something that you really want to avoid, because a lot of times it's a presumption that you're making based on an appearance, and it's just something that I encourage you to eliminate from your vocabulary, which has been a real struggle for me, so I understand how difficult that is.
Well, also military.
And military, yeah, I come from an Air Force family, so got a double whammy. So in the room, in any context, when you're introducing yourself and making them feel welcome, the things that I will usually say to folks is, my name is Kevin, and I use he, him pronouns. I also wear a badge that has a bunch of pins that say he, him on it. So if it's something that I forget to mention, it's easily visible on me. I think that's an important thing. So I have little pins that say that. But if it's something that can be incorporated into official badges or is somehow displayed in some official capacity, that can go a long way when you're interacting with somebody who's trans or non-binary. It really sets a tone of, okay, this person kind of has a sense of why this is important to me. So, like I was alluding to earlier, it is fine to ask somebody how they want to be addressed, what pronouns they use. Those are all respectful things. You're trying to meet them where they're at. You're trying to use terms that are affirming for them. And that is a great way to start off on the right foot. And then following up that, using those names and pronouns goes a long way. Something that you may or may not encounter is a lot of trans folks have specific terms that they use for body parts. So sometimes it is inevitable to, specifically say something like uterus, vagina, specific organs. But in general, there are many people in the community who prefer to use terms like bottom, front hole. Just reflecting those terms back to them can kind of show them that you're listening to them, you understand why it can be dysphoric, and you're trying to meet them where they're at. When you're asking about gender identity, there are a lot of ways to do this, and there's not really a rude or wrong way. So how do you identify your gender identity? I find that a little bit fidgety. What was your sex assigned at birth? Totally fine to ask. Or if you have the time, tell me about yourself. There's a lot of open-ended ways to get the information that we need. And one of them would be, it's somewhere around here. Oh no. I might have hidden the slide because I thought it was specific to the ED. Any forms that we use, having areas where somebody can just write in the name that they want to be called, or having an area where they can specify pronouns, can be hugely helpful for this community. And for somebody who's cis, it's not a burden. You just write in your name and you X through the pronouns that you use. So it's not a burden for us, and it can be really, really beneficial for trans and non-binary folks. So it's something that I encourage to be incorporated into any official documents that are used. This is specific to writing in charts. I forgot to hide that. I'm not going to talk about history taking, but if you need information from a trans person, just remember to avoid asking questions out of curiosity. If you don't need to know what their genitalia looks like, do not ask. Unless it is something that you need to know from them, it is something that is incredibly invasive, that you would never do to somebody who is cisgender, you're walking up to on the street or in an emergency situation. So doing that to a trans person is really, really rude. So most of the physical exam stuff I'm not going to touch on, but there are specific things to the trans and non-binary community that might come up that you might see, particularly if you have to do compressions on someone. Trans men, people who were assigned female at birth and identify on the masculine end of the spectrum, will oftentimes wear what we call binders. So these are basically, they go around the chest. They usually have either Velcro or hooks that compress the breast tissue so that if they put clothes on over it, it's going to have more of a masculine frame. They're not going to have the appearance of having breasts. So that can be really important because although most of them are pretty safe and we tell them not to wear them when they're exercising or sleeping, if they're wearing them around during the day, it can reduce their ability to draw in a full breath. People who wear binders and have asthma, it's a terrible combination. People who have binders and smoke, also a terrible combination. So this is something that could influence a medical situation where if you pull open somebody's shirt or you're doing compressions and you feel something underneath it, that's probably something that you would need to remove in that situation. And usually, most of them are Velcro, so it's usually pretty easy. And then just in terms of appearance, some trans men will wear or have penile prostheses. Trans women will often wear padded bras or do tucking if they still have a penis and testicles. So there are just different variations that you might see that people are doing to help them feel more comfortable in their body or when they're out in public. Questions about those things? This is stuff that's more particular to my realm. But oftentimes when it comes to healthcare, a trans person is going to prioritize affirming their gender. This is something I see in my older trans patients in particular. If we're talking about starting hormones and they have not been on hormones before, there are certain medical risks that I discuss with all of my patients that are more pertinent to an older population. And I have never had an older person who we have sort of that risk-benefit discussion who opts out because of those risks that I'm presenting to them. So they understand risks that are taken, and the need to affirm, their desire to affirm their gender is more important to them in almost all circumstances. So that can apply to a lot of healthcare contexts. We touched on it earlier, but it's important to remember many of these people will have had negative experiences with healthcare providers, and it can be a real disincentive or make them very scared to interact with the healthcare community. And then, I said it before, I'll say it again, avoid asking questions out of stray curiosity. Unless you need to know, don't ask. I have some information about what we're doing at Freighter. This was more for the ED residents. So I'm hoping to kind of open this up and see if you have any scenarios that you've come across or questions that have been generated while we've been talking today.
I got a question for you. Now you say people are growing with this and they think about it. What about Bruce Jenner? How does this fit in with his life? I mean, I'm like, it's an interesting thought.
Yeah. So oftentimes, it's most of my patients come to me when they're in their teens or 20s, so pretty early in life. So that's a common scenario, and you can kind of understand that. They were growing up, they maybe didn't feel comfortable coming out until they were away from home or had time to sort of grapple with it on their own or work with a counselor. There's so many reasons that it might be a little bit delayed for them to come out as transgender, even if it developed at puberty. I have patients, like I said, my oldest patient is in her 70s. And then I have a scattering of patients in their 50s and 60s. So these are people who grew up in times when it was not acceptable to transition. And they have come to a point in their lives where their desire to affirm their gender is more important than, many of them have kids. They may have grown, they may have been playing the role of a cisgender person for decades. But that buildup, that innate sense doesn't go away, and eventually they come to me in their 50s, 60s, and 70s, and they're ready to make the transition. And that can be, any transition can be really difficult. And when I say transition, that's when we're referring to using hormones, medical and surgical options to affirm their gender, which can pretty dramatically change external appearance, and they will often be changing the way that they're dressing or speaking. So it is a dramatic thing, and they, at that point in their lives, understand how difficult it's going to be, and with that understanding, like I said, almost all of them will choose to proceed with hormones or whatever they're interested in. I think I kind of circled around your question. I don't know if I answered it.
to me, to me, it's just like I have the money and I can do it, or, you know, you don't think that, you know, it's just confusing why somebody at that age would go through that.
Yeah, I see it all too often. I think we can underestimate the social pressure to conform with things like gender roles, especially if it's something that you've played along with for a long period of time. Some people will feel trapped in a role where they feel like they can't disclose that information to anyone ever, and they're just gonna have to hide it and press it down for the rest of their
Because
lives.
of popularity or something.
So we talked a lot about the trans and gender dysphoric community, but you started this lecture with information about lesbian, gay, bi, LGBT, I don't know what all of them are.
Right.
Is there special considerations for a lesbian and gay community that we could possibly be unaware of when you consider that we've been sort of desensitized to the lesbian gay community since probably the early 70s?
Yeah, and you know, the main reason that I included them with the genderbread person is because oftentimes people have not pieced apart in their minds, because you know it's not something that we often think about, sort of that distinction between gender identity and sexuality, which are two separate considerations. And as you alluded to, the transgender community is often lumped in with gay, lesbian, bisexual, any of the other letters that get thrown into that mix. So the trans community definitely has distinct medical healthcare needs and social needs. I don't want to discount the disparities that exist in gay and lesbian people, but they are certainly much better off, and they're not at risk for, you know, in most cases it's not externally apparent what their sexuality is. So they
don't seem to be uncomfortable with it either. I mean,
it depends
there
on...
seems to be a certain amount of discomfort associated with trans community, and that you don't see, I think, in the non-heterosexual community.
Yeah, so I definitely agree. I think the disparities and the social stigma against the transgender community at this point is much greater than it is for gay and lesbian folks.
So is there a higher suicide rate among any one of those particular groups?
That's a great question. Much higher suicide rates in the trans community, particularly in trans youth. It is, I would just be making up a number if I spit it out to you, but it is many fold times greater than cisgender teens. So it's a big concern. There's actually a separate suicide hotline for transgender folks, which is called Trans Health Line, I think, which is staffed by trans and non-binary people. So if a transgender person is contemplating suicide and they don't want to call the national hotline because a lot of the questions would lead back to their gender identity, that is somewhere specifically that they can call and talk to somebody who would understand, who would be, you know, informed about what they're going through.
So this whole thing is about being more discriminating than less discriminating.
How do you mean?
Well, we're being taught about this particular group of people and their needs, but it's not about the needs of the general population and how these people fit into it so much. And it seems like that there's a possibility that could cause some of the emotional distress. The fact that
They're being singled
we're
out.
sitting here being trained to point out this group and to treat them special. And
I would try and reframe that as I'm trying to give you the tools to interact with this community with the same respect that you would with anybody else.
This is Tess Corners Rescue. We have a request for rescue at 775 West 13940 Bloom Drive for a 66-year-old male who is having a possible stroke. He is breathing, he is conscious, he is alert. This is Tess Corners Rescue. We have a request for rescue at 775 West 13940 Bloom Drive 66-year-old male who's having a possible stroke. He is breathing conscious and alert. Tied out at 1955.
It's cool to be on this side of it. Your question is something that we thought about when I wasn't around when our clinic was founded, but it's called the Inclusion Health Clinic. And people brought up the fact that, aren't you excluding people by only serving the LGBTQ population? Which in some ways is true, although we don't check anybody's trans or gay cards when they come into clinic. They can schedule freely as they want. But our goal, and this is somewhat sort of tangentially related to your question, our goal is to give them the quality health care that anybody else can access if they go into just a general PCP's office. That's my goal.
Well, I guess, what George is maybe referring to, and stop me if I'm wrong, when you were on a rescue call, as we're going out right now, and we have a total of possibly half hour to 40 minutes with that patient, from the time that we're called out until we got, on scene time.
Yeah.
And we're dealing with that, we're not looking so much as far as what that gender is, or what we're looking at what is your problem?
Yeah.
What do I have to do to take care of your need, your injury? What can I do? Do I have to do oxygen? Do I have to do a splint? Do I have to do, a CPR? What do I have to do for that?
And even coaching for emotional support, we get a lot of anxiety attacks are a great example. Regular old people have an anxiety attack, they need to be coached and they need to be treated like everybody else.
Yeah.
So we don't really discriminate, we don't look at that now. And I understand the purpose of the training, don't get me wrong, but
I think the ability to be able to see something and be able to address it, but not as the primary, but as a secondary. Our job is to stabilize this patient, get from point A to point B, and let's get it done.
Yeah.
If we see something that this will probably help us open our eyes a little more, that we can address it, but our concerns right now is to stabilize this person and get him, into the hospital for care. And if we have a prolonged transport, if we have the time to, get personal with the person or the patient, and a lot of times, you're 15, 20 minutes to a hospital and you're shooting a breeze, and as long as we make aware that there's things to be aware of.
Yeah, I totally agree. This probably will not impact your job very often. It may never. Many people have never met a transgender person knowingly.
We could hire one.
Yeah, absolutely. I would encourage you to. We have providers at my clinic who are transgender, and it provides enormous value to our organization. I think just having the awareness, the tools to interact with this community, if it does come up for you, will go a long way. Especially if, for example, somebody's having a panic attack and it's because they're having distress about their gender identity. Like, that could pay dividends.
So in this population, what are some medical conditions that we should be aware of? That's one of my biggest concerns.
This was something that I was thinking about when I was coming here. There's really not a whole lot that is going to affect the trans community that wouldn't apply to the general population. When I am counseling people on hormones, giving testosterone really doesn't have urgent medical risks. It's relatively safe. The biggest risk is that you could produce too many red blood cells, which would predispose them more to strokes and heart attacks. But it's not like you would treat them differently if you encountered that in the field. Trans women, if they're receiving estrogen, have an increased risk of blood clots. So if you have a trans woman, she's short of breath, she may be more likely to have a PE than another person off the street. But we're talking a marginal increase, so it's not something that, if you see a trans woman and she's short of breath, I don't want you to immediately be like, this person must have a blood clot. I encourage you to treat them the same, use the same approach that you would for anybody else in those situations. So I was trying to think about it in case there were specific cases, but really, for the trans community when it comes to emergency first responder care. Same standards that you would use for anybody else for most of these scenarios, for all of these scenarios.
So then going off that, for like trans women who are having shortness of breath and like chest pain, obviously we gotta put 12 lead on, but then they have those binders.
Mm-hmm.
You just gotta tell them like, you gotta put this on you.
Yes, and if they are conscious enough to remove it themselves, and if you explain why you need to, that's gonna go a long way. If it's an emergency situation and for whatever reason you need to remove a binder, use trauma scissors, do whatever you need, they're not gonna complain. But yeah, if you have the time and the opportunity to sort of say, hey, I see you're wearing a binder, we really do need to put these leads on and here's why, I don't think you'll have a problem. I'm sorry.
The one and only one that I can think of that would definitely throw somebody for a big loop would be, a pregnancy type thing, pregnancy situation.
That's a great
We have
point.
someone that looks like a male, driver's license says male, they did everything, it says male. Either they're having abdominal pain or something's going on. How do you, hopefully they're able to tell you that, hey, I'm pregnant, by the way, but if they're just calling for abdominal pain and they can't tell you something like that, I guess, how do you prep or ask, or where are you gonna go with that? You're having abdominal pain, I don't know why, you look like a guy, everything's normal that way, and then all of a sudden, now we're having a kid.
It's a great question. I'm glad you brought it up because it's not something I thought of, but trans men can get pregnant. Sometimes that is by choice. They would not be on testosterone if that was the case. But if somebody is on testosterone, it is not effective birth control. So trans men can get pregnant unintentionally, not know about it, have abdominal pain, have vaginal bleeding, and have no idea why that would be. How you would suss that out in emergency transport.
Code 2 to the hospital.
Great question. If you have asked their sex assigned to birth and their gender identity, it can be a pertinent question. Many trans men will eventually choose to have a hysterectomy, so they may not have a uterus, so that could eliminate a concern. A lot of trans men will be very uncomfortable with the topic of vaginas, uteruses, pregnancy in particular. So it's tough and I don't have a great answer.
Do you go down the route of, is there any chance that you...
Is there the potential for pregnancy? Yeah, I think that would be a great way to approach it.
Well, we've had those calls where people have been pregnant and gave birth on the toilet and never knew they were pregnant.
Somebody has to be that.
You go down that's one of the ones that I can think of.
No.
We're going for a general abdominal pain, and next thing you know, we're getting an OB kit out.
Yeah.
Because you would be asking somebody that you were assuming
And we are not proposing that you ask anybody who appears to be a man whether they're pregnant.
But that's the point though, is like, if it's somebody who is.
So this would be a situation where you know that this is a trans man and you're sort of thinking more broadly about what could impact
And
them.
hopefully you know that they're a trans man.
And they may not choose to disclose it to you, and if that is the case and they look like a man, I don't think anybody's gonna fault you.
Right, and then you're going down the rabbit hole down the road.
Yeah.
It's up the rabbit hole.
Up.
Yeah. I mean, that's one of the ones that I can think of that would give us.
That's a great point. I'm glad you brought it up. I wish I had a more specific and broad answer for you. Other questions, other scenarios that you can think of that this might play into? I really appreciate you all being here. This is something that's really important to this community, and you could literally save a life just using some of these basic concepts. So I appreciate you giving me your time. And if you do have any questions, I'll write my email on the board. Feel free to shoot me an email. This is stuff this is really a passion for me, and something that if you have questions or concerns, I would love to help address them.
Thank you very much.
Very enlightening, thank you.